Welcome to Magnesium 101. In this video, I want to help answer some questions you might be having about magnesium. And in this video, I'm going to cover why magnesium is even important to take, what are the different forms of magnesium and which form is good for what purpose, and how to basically go about adding magnesium safely as a supplementation into your diet. Over the years, I've learned how critically important it is for certain people to be taking a magnesium supplement. If they're not, they actually have significant myofascial tightness and other issues that are impacting their capacity to heal and move better. Magnesium is an essential mineral for your health. In the same way we think about calcium, but it plays a crucial role in a wide range of physiological processes in your body. Magnesium deficiency is a more extreme version of having a higher functional need for magnesium. In both situations, you don't have enough magnesium to meet all those metabolic needs. But obviously, having a deficiency is much more severe. There's actually a simple blood test that your primary care provider orders and to check to see if you have a magnesium deficiency. But that's not going to tell you if you have a higher functional need, because that test shows how much magnesium is in your blood plasma. So for all the magnesium that you're actually supposed to have in your body, most of it is stored in your cells and only 3% of it's in your blood. So you can have a normal magnesium level in that blood test, but still really have a higher functional need for magnesium. Here we are taking things a step further, trying to think about how to be more savvy about our wellness. So what does magnesium do? Well, magnesium is importantly a cofactor in over 300 different enzymatic reactions in your body. So enzymes are proteins that facilitate and regulate various biochemical reactions. Magnesium is required for those enzymes to actually work properly. And these enzymes are involved in things like energy production, DNA and RNA synthesis, protein synthesis, so really important stuff. Magnesium actually helps to regulate your muscle contraction and relaxation by influencing the balance of calcium and potassium ions within your muscle cells. So it's critical for your muscles to be able to relax. Very important when we talk about tightness. Magnesium is also important for proper functioning of your nervous system because it helps to regulate those transmission of nerve signals, and it actually has a calming effect on your nervous system, which we'll talk about in a little bit. And while calcium is what we think about when we consider bone density and preventing osteoporosis, magnesium is also essential in bone structure, and it's involved with that bone mineralization and maintaining that healthy density to your bone. And magnesium is really important in maintaining a steady heartbeat and regulating your blood pressure. Magnesium is also involved in regulating your blood glucose levels, so your blood sugar levels, which is really important. It actually influences insulin sensitivity, which is what we want for health and wellness and longevity. It's super important. It's a really hot topic these days. Not getting enough magnesium is actually associated with having a higher risk of type 2 diabetes. Your magnesium levels are inversely related to your blood insulin levels. So that's why people that have diabetes or metabolic syndrome tend to be very tight and have a lot of soft tissue restrictions. That's because the magnesium isn't there to offset that calcium and potassium balance for that muscle relaxation. Magnesium, believe it or not, is also involved in the production activation of your immune cells, so it plays an important part of a healthy immune system. And like I said previously, magnesium is required for that synthesis and stability of your DNA and your RNA. So obviously that's essential for life, your health and wellness. Magnesium in sleep is also a very hot topic these days. And that's because, like we talked about the nervous system, magnesium is a natural NMDA antagonist. It means it blocks the excitatory neurotransmitters in your brain, and therefore it promotes binding for GABA, or calming neurotransmitters in your brain. So now that's obviously going to support relaxation and sleep. So what causes a functionally higher need for magnesium? If you experience excessive muscle tightness, muscle cramps, even in some cases restless leg syndrome, then you likely have a higher functional need for magnesium. Those metabolic needs for magnesium are not being met. So there's various factors that affect magnesium absorption, utilization, and excretion. Stress, whether it's good stress from increased amounts of exercise or bad stress from life, stress causes a release of cortisol. Cortisol prevents you from properly reabsorbing magnesium in your kidneys as you should, and so you end up peeing more of it out. So if you exercise a lot and have a lot of tightness, or if you have a really stressful job or a really stressful life and you have a lot of tightness, then chances are that you have a higher functional need for magnesium. And sometimes if you just have little upticks of stress in your life, sometimes you need to increase that dosage as well for a short period of time. Believe it or not, a high calcium intake can actually block magnesium's absorption because they compete for mineral binding and absorption. It's common for people to have a high consumption of calcium because it's fortified in a lot of our foods, and it's common for people, particularly women, to take a calcium supplement without magnesium associated with it for general wellness and to prevent osteoporosis. That's going to interfere with your ability to absorb magnesium and throws off that mineral balance. Obviously, the food you're eating can have a big impact. So diets that are going to be high in processed foods, refined sugars, low in magnesium-rich foods, like those are going to be leafy greens and nuts and whole grains. You're just straight up not getting enough of it. But even a diet that's high in fiber and high in protein can reduce your magnesium absorption. Age and genetics plays a role in your ability to absorb magnesium and other nutrients properly. And something very important that isn't talked about that much, having low stomach acid. So people that are prone to having like H. pylori infections and even some cases of acid reflux, having low stomach acid, you don't break down your food properly, even high alcohol intake is going to impede your ability to absorb proper nutrients like magnesium. Now, beyond the issues I just listed, gastrointestinal conditions like celiac disease, Crohn's disease, and IBS play another really important role in that. It really takes things to another level. So if your GI tract is inflamed and there is not a good mucosal lining and you're having difficulty absorbing your nutrients, particularly the minerals and vitamins from your food and your supplements, you can see where the problems are going to start to layer on. And so we already talked about that chronic stress and good stress and bad stress, but poor sleep actually raises your cortisol levels, and that prevents you, again, from reabsorbing that magnesium. Overall, most people obviously don't have absorption problems, but if you tend to have ongoing diarrhea and constipation, experience excessive tightness, difficulty sleeping, then you really want to look at your gut health, and a magnesium supplement is something that you want to start thinking about. And then the form of the magnesium with those particular issues is actually really important. So the best type of magnesium depends on, obviously, your need and preferences. So there's various forms of magnesium, and this is kind of a big question that people have. Here are some common types of magnesium supplements and their properties. Magnesium citrate is the most commonly used as a supplement because it's fairly inexpensive to produce, it has pretty good absorption and pretty good bioavailability. So magnesium citrate is basically a general form of magnesium supplement that's pretty safe and good to take. If you really need to make sure that you're getting the best absorbable form of magnesium, well, that's going to be magnesium glycinate. Because it's so easily absorbed, it's going to be really gentle on your digestive system. So if you want to make sure that you're increasing your magnesium absorption and you have a sensitive tummy, you don't want to end up with any tummy gurgles, then magnesium glycinate is going to be the choice for you. Now, on the other hand, if you deal with chronic constipation and you actually want the laxative effect, then a straight form of magnesium oxide is going to be the best choice for that. So magnesium oxide alone has a high magnesium content, but it's not absorbed easily. So it's going to help really move things along inside the GI tract because it's not being absorbed, it's just getting pushed through. Magnesium malate is actually known for supporting cellular energy production, that's cellular ATP, which is super important, and then supporting muscle fatigue. So if you have any muscle fatigue, cramping, tightness, muscle pain, then magnesium malate is definitely a form you want to consider as part of your recipe. Another form that's not often discussed is magnesium taurate. This is a combination of elemental magnesium and the amino acid taurine. This form is considered to be the most supportive for your heart health. So it's a good option for people, for everybody, but if you have any cardiovascular concerns where magnesium could be a supportive nutrient, then you want to make sure that this is part of that recipe. Magnesium chloride is the form that you're going to use topically. So this usually comes as a gel or spray, and it can be applied directly to your skin. Now, some people will get a rash from it if you put it directly in an area where you feel like you have the most tightness, So it's really easy to put on the bottom of your feet, and nobody usually has an issue with that. And you absorb magnesium very easily through your skin. It's a great solution for people who can't tolerate oral magnesium supplements or can only tolerate a certain amount but require a higher dose of magnesium. So something to consider if you are taking magnesium but you need more of it, you're not really getting the response that you want, getting a topical one is a good idea. Of course, we can't forget about Epsom salts. This is a very common thing for people to be using in their baths. They usually don't realize it's because of the magnesium sulfate, another form that's easily absorbed through the skin. So now you understand why using Epsom salts in your bath helps relax your muscles and relieve stress. So some important considerations for supplementation are going to be, why are you taking the magnesium? Obviously, the purpose is important, as we just talked about. So the different forms have different goals. So some people find different forms better to digest, and so your tolerance is going to be an important part of that story as well. Dosage is important, and probably the biggest question that people have: how much should they be taking? There's a lot of different recommendations. The amount of elemental magnesium in a supplement varies greatly by the form, but also by the product. You can start pretty safely with a form that best suits your purpose and tolerance. Start at a lower dose, like 250 milligrams, and make sure you're taking it with food. It's going to help with that absorption process. So you can increase that amount slowly over several weeks and see what your tolerance level is. In general, the biofeedback to your tolerance level is going to be tummy troubles. So as long as you're absorbing the magnesium properly, when you get to that point where you've reached that functional need and you've stopped absorbing all that magnesium, then the dosage actually needs to be decreased. You will start to develop some diarrhea or gurgly tummy in general, and that's just a good indicator that it's time to decrease that dosage. My safest, most confident recommendation for magnesium supplement is Designs for Health. This is an amazing research-based functional medicine supplement company. Excellent products. They have a Magnesium Glycinate Complex. This Magnesium Glycinate product actually features Magnesium Bisglycinate Chelate, which is a highly absorbable form of elemental magnesium. It's also a buffered combination. This helps to promote that bioavailability and absorption. This formula is really unlikely to cause any GI issues because it bypasses normal modes of absorption, so it doesn't actually interfere with other minerals being absorbed, so it's really cool. I hope you found this detailed information about magnesium helpful and answered some of your questions and gave you maybe a place to move forward from. If you have any other questions or found anything in particular helpful, please comment below. I enjoy providing this practical, quality information to support your health and wellness journey. As always, I am not establishing a doctor-patient relationship, and this information really is only for educational purposes. I want you to have better information so you can ask better questions and get better answers for your health, your wellness, and longevity.